So I'm sitting here with Klaus Johansen from Danske Bank Asset Management. Klaus, could you tell us a little bit what you do at Danske Bank?
Yes, I'm part of a team of 16 people, and we invest in global equities. So it can be European companies, American companies, Asian companies, and I'm the healthcare specialist. So I'm advising our portfolio managers in what to invest in different portfolios.
But do you have any guidelines or rules-based strategy that those companies we do invest in? What's your mandate?
Our mandate is to invest in companies with a market cap above $5 billion, and when we typically invest in companies with high returns, and we look for companies which have shown stability in the returns they have earned over the last 10 years. So and that's because we tend to believe, and we can show that with data, that they will outperform the market. So we look in this direction and try to find companies that is undervalued.
So looking at your time horizon, your perspective, do that differ between the companies you invest in, or what's the general picture?
It can depend a lot about the situation, but it can be anything from 1 year to 4 years. Our average holding period is like 3 years, so it can be anything.
So you kind of have like a target price.
We are long-term investors, and we tend to invest in companies and that we can see there's not just one catalyst, but several catalysts going forward.
And if things would occur in the company, you will revalue your position, and
yes, we constantly evaluate if it makes sense to keep the position in the company.
You're an active investor in that sense. You're always readjusting if that's needed, if you feel that's needed. So you're not investing in any companies that's not in the market right now. They have a cash flow in. Yes, correct.
That's correct. Yes. Yeah. So we look at companies that has a good profitability, and of course they have to show their stability over a few years. Is
there any specific case that you want to bring up right now that you find very interesting?
It could be pharma companies. It could be a company like Roche. It could be a company like AstraZeneca. It could be companies that are manufacturing equipment to analyze drug substance. So that's big machines that are sold into big labs. So it can be anything.
What would you say is the biggest challenge in investing in this sector?
It's a complex sector. I've been doing this for 15 years, so I've learned a lot over the last many years. So it's you have to be able to go deep. You have to talk to experts. You have to talk to doctors to evaluate if a new, let's say, compound that is potentially coming to the market, how will the doctors perceive this new treatment? Can it be combined with other treatments in the market, and also what's coming behind from the competition? So you have to have quite a wide network of experts you can talk to and rely on. So that's why I go to medical congresses to United States to see what is being presented, what could be coming from the big companies and the smaller companies in the near term. And near term, that can be within 1 to 3 years. So we're constantly monitoring and scouting the market for new therapies.
So basically, it's top-down and bottom-up analysis of the market always.
Yes. Yeah. So it can be sometimes, that could be. That can be, let's say, if there is a new regulation in China, for instance, for diagnostic companies, that could be a fear in the market that this could be, let's say, a persistent issue and we analyze this and and found out it could be a temporary issue, but maybe the share price has gone down a lot, and we evaluate if it makes sense to invest in this company.
Are there any like dark clouds out there right now on the market that you keep your eye on, that you feel like this is a potential risk?
I'm investing in the whole healthcare space, so there's a lot of things you have to monitor. But I think definitely the US and the political debate that is taking place right now ahead of the US election. There's definitely a cloud out there, and what Republicans and Democrats they discuss about what kind of reform that could take place within both, let's say, drug pricing, but also reimbursement of tests in the whole hospital system. So there's a lot of things going on right now and taking place. Also, just the nature of there's always, let's say, competitive pressure. And there is a pressure inherent in the system that you want to make tests and treatments cheaper and cheaper and cheaper. So you have to look into that constantly, also in Europe.
So if we look on the bright side, do you see any trends or technologies emerging now that you keep your eye on that you think is interesting?
I think we have seen a lot of innovation within antibodies. We used to have a very targeted approach within antibodies. Now we have bispecific antibodies, and we'll see more and more data coming out from medical congresses, so we can evaluate if they are, let's say, better in terms of efficacy, but also we have to monitor the safety of these new compounds. But that's something that I will monitor over the next 1 or 2 years. Definitely. We have, of course, also seeing gene therapy evolving quite rapidly right now. It has been a thing we have been looking at for the last 30 years, but we are seeing let's say a new wave of treatments, and that's great for patients.
But talking about gene therapy, there's really the price discussion about the drugs, because some of them are really expensive.
Yes.
Should they be? Is it fair that they are? That's the pricing of it. That's one of the debates, right? They are having right now in the US.
That's definitely a debate, and it's really hard to measure exactly what is the value of saving a life, and there's different let's say things to take into account.
Yeah, the social benefits, because
there's a
it
social
might cost
benefit,
even more.
There's a social benefit, there's a quality of life aspect, there's also a cost of avoidance in the system. If we didn't treat this patient, what would the patient costs in terms of alternative care? So there's a lot of things to monitor. I definitely think that all companies should look into that for instance, the pharmaceutical industry is not a very loved industry, because they are they're perceived as having drugs priced at a very high level. And I think going forward, the whole industry needs to, from an ESG perspective, needs to take that into account, that there needs to be seen as let's say, a benefit to the society. So they have to be carefully in setting the right price, and they have to do the right calculation in terms of quality of life, and that is priced differently in Europe versus US currently.
Thank you, Klaus.